It's a busy day down there. Give me your sense of how Donald Trump is rising to the bar that he set for himself yesterday when he declared himself a wartime president.
Well, the president is continuing to use that language, saying that he feels like he's a wartime president. He's also said that he rates himself a 10 out of 10 when it comes to how he's responded to this. But it's clear that healthcare officials and doctors and nurses all over this country are getting very, very worried as medical supplies are starting to run out. You see, just today, there was an NBC News story showing that hospitals and medical professors are asking Congress to give them hundreds of billions of dollars, or at least $100 billion, but probably more, for specific medical equipment. And then you have the president saying, look, we're not a shipping company. So the president's been clear with governors. He said, look, we're not a first resort. White House sources here tell me that that's being meant to say states need to try to take care of themselves, and the White House is going to do what it can do. But it's clear that the White House doesn't have answers to two key questions. The first is, when will people who need coronavirus tests actually be able to take them all over this country? There was no clear answer from the White House today. And the second one is, are there enough ventilators, and is the White House going to be able to order enough ventilators in time for what we know will be a crush on the medical system? The answer there was there are thousands of ventilators being ordered, but the White House is not saying specifically how many they will be shipping out and whether or not there's a reserve enough for each American. And that, of course, is pretty scary.
Dr. Esper, I want to ask you what you think you're hearing right now from Donald Trump. We are obviously hearing these calls, the alarm bells being rung in all quarters right now, and the president is answering them after a fashion. I'm curious about what you think about the state of play out there on the front lines, and whether what the president is saying he plans to do, the leadership that he's giving to states, cities, the private sector, the medical sector, all the above, whether it's adequate to the moment as we now get into Thursday here in this week.
You know, John, this has been a long time that we've been preparing, and this is something that we've known about for months, even though that it was only numbers in China for the longest time. We here, especially here at Cleveland Clinic and all around the state, have been preparing for the concern that this could happen and it can overwhelm. And so we have been meeting here at the Cleveland Clinic twice a day in the command center, making sure that all our preparations are met and everything is being done as best we can. And one of the best things we have been able to do, certainly we have been able to work with the governor, with the Ohio Department of Health, and they have been helping us tremendously. Now, certainly there's a lot of things that have to happen at the federal level. Just because there's a lot of cases in New York, that doesn't mean it's not going to be Ohio's problem if we start seeing spillover. And so there is a national response that has to happen. But definitely the boots on the ground right now, as we see it, we are working extremely hard to prepare for these waves of infection and trying to work with all our partners in order to stem that tide, to make sure that we flatten how many people show up at our doors sick at once. And that's why we're doing all the social distancing. That's why we're doing all the communication to make sure everybody knows what to do.
But, Doctor, I appreciate your confidence and can-do attitude, which I think everyone appreciates. I keep hearing, listening to these governors, listening to the people on the healthcare front lines say there's going to be shortages. There are already shortages. We're talking about people talking about making protective gear out of bandanas and scarves. I just want you to kind of paint a picture of what it's going to look like when this wave crashes down. Obviously, it's not going to crash down with the same force everywhere in the country, but it seems like there are plenty of places where it is going to crash down and where there are going to be shortages. What are the implications of that for the fight against this, the fight to treat this pandemic when it starts to hit in the places that it hits hardest?
Listen, we certainly know that there's going to be a lot of people, and there's going to be a lot of people that are going to get sick. And what we're also trying to do is we're trying to prevent sickness from coming to the healthcare provider, because if we get sick, then there may not be enough people to treat the individuals who are coming in sick. And so we all know that we're in this boat together. Listen, in a crisis situation, in a pandemic, all options are on the table. And certainly we know that we're looking for N95 masks, and while the recommendations are so that we don't need as many N95 masks, but we can use surgical masks. But if we can't use surgical masks, you do whatever you can in order to protect yourself and to protect your patients. And we are using every option, everything that is available to us. And, again, Hospitals understand this, and we are, taking in suggestions and ideas from everyone, from the nursing staff to the respiratory technician to the guard at the parking garage. Everybody is giving us ideas, and we are taking each and every one. I can't say, that it's going to be pretty. It's not going to be pretty. This is a pandemic. This is a crisis. You prepare as best you can. And let's be honest, this virus has been throwing us curveballs from the beginning. And yeah, we've missed a few times, and we just have to get back into that batter's box and try to hit it some more.
Maya Wiley, I want to ask you, you have been a longtime player in this community here in New York, and you've seen Governor Cuomo, you've seen Mayor de Blasio react in a lot of different situations to some very difficult times. Given the alarm that we've heard from the governor in particular all week long, talk a little bit about kind of assess the state of your state and your city right now, and whether you think that it's possible for local government, for the city government, for the state government to be able to step in when they're not getting apparently what the governor has been begging for, not getting from the federal government what they seem to need.
Well, I think one thing that's important to know about both New York State and New York City is that we have a tremendous number of public servants, including the governor himself and the mayor himself, who have actually been through this before. So we had the Ebola crisis in 2014, and I was working for City Hall when we had that crisis. Whether it's the state or the city, there is a level of leadership that has been planning for this kind of emergency. I think the issue is, and what we've seen from the governor, who's actually raised some red flags around the possibility that the Trump administration is still playing partisanship at a time when we shouldn't be seeing either red or blue, in terms of withholding some financial assistance that New York had in the form of a competitive grant for hospitals. He has asked for more ventilators, and he's right to, because we know we don't have enough when we have the most cases in the country. One of the things that Mayor Bill de Blasio did is he asked, and this was weeks before we got to the situation we're in now, our 11 public hospitals, we have a tremendous number of residents who rely on public hospitals. They don't have private insurance. Many of them may not have health insurance through their jobs, even though they work multiple jobs. And one of the things that we're seeing is that our public hospitals were working on finding 100 ICU beds for each hospital weeks before we were in a situation where they would be overrun. This is not a state or a city in which local leaders have not been taking steps to do everything they possibly could. I would say the same thing for Washington State and California. Trump even praised California and Gavin Newsom today. That can't change. That no state or city can handle something of this scale without national leadership. If you want to call this a war and you want to call yourself the commander-in-chief, then you better command, and commanding respect means demonstrating that you will do for the people who are the citizens of this country and the residents of these cities.
So, Nick, I ask you about this, right? I mean, we started this week with Governor Cuomo saying, the Army Corps of Engineers, I need them to come here. We are going to be short of hospital beds. We're going to be short of ICU beds. I need the Army Corps of Engineers to come here and start building. I need them now, right? It's Thursday. Nobody's here building those things right now. The president's talked about trying to help Governor Cuomo. He's talked about the Army Corps of Engineers. He's signed some authorizations over the course of the last day. But there's still this kind of lassitude about his attitude towards it. The things he said about we're not postal clerks. Just everything feels like not that the president has not seized this moment and said, although he's claiming to be a wartime president, and saying, okay, this is what's now about to happen. The federal government is going to go student body left, and we're going to provide everything that states need. Here, all of these private sector institutions, but companies around the country that are offering at this point, how can we help? How can we we'll shift our production to ventilators. We'll do whatever's necessary. Someone's got to tell us what needs to be done and how to do it and when to do it and get some financial support for it. None of that seems to be happening right now. Talk about how whether Donald Trump is missing this moment, and if he wants to try to live up to being what he's trying to portray himself to be, which is a wartime leader, what would have to happen and how can he start doing that?
I mean, look, the president is missing an opportunity here to secure his political future and the country's future. And that's what makes it so surprising for a man who's so attuned to the politics of everything that he seems almost a bystander to his own White House in this crisis, seems almost to be surprised by things that are being mentioned at the podium next to him or around him at all times. You know, he's making a comment about how the U.S. government is not a postal clerk. We own the postal system. And the U.S. military is probably the greatest and best mover of materiel and people in the world. They're very good at this stuff, at moving quickly, at doing large jobs. There's a lot of buttons he could be pushing. And you're right, there does seem to be this absence of urgency. And I think on this very show over the last 2 years, we have talked about what would happen when this president was confronted by a crisis that he was that was beyond his own making, right? This is partly his own making. But we are now seeing a certain kind of president with a certain skill set confront this moment that is beyond him, and it is a bit frightening.
Yamiche, talk a little bit about this, about the stuff the president said today related to potential treatments that might be brought to bear on the virus. He made some statements today about having slashed red tape to allow for new kinds of trials of those drugs. I'm going to ask the doctor about it in a second, but I know there was some confusion down there today when the president said some things in a press briefing that then kind of had to be walked back by some other officials at the federal level. Talk us through what he said and what then got walked back and what we now know to be the case with respect to some of those kind of potentially promising drug treatments that might be on the horizon.
Well, the president said that he was eager to get treatment for the coronavirus out to the general public. And what he said he was going to do was change the regulations at the FDA so that there would be a lot of different drugs fast-tracked. And in doing that, he also mentioned that there was already a drug coming out of Africa that would already be fast-tracked and that people could already take. Then the head of the FDA actually walked that back and said, look, that drug is actually in clinical trials. Those trials, of course, could take months. So this is not something that's immediately available to people who could get sick from this virus. So that's a big difference. And we've seen the president do this over and over again, where he's eager to say, look, this is all that I'm doing, when in fact, that's not what's happening. That goes back to the issue of testing. He said early on, weeks ago, anyone who wants a test can get a test. That was not true then. It's not true now. So in this case, when it comes to these drugs that the FDA is looking at, they have not been approved yet. The other thing to note is that there are some senior officials at the FDA who are very worried about the fact that these are being fast-tracked. They say people could be harmed. Of course, there are people who could also benefit from these drugs, but there is the idea that there could be some patients who are given drugs that are not ready, who could then get even more sick if they have the virus.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.